Good afternoon, everyone. I'm Dr. Rishwa. I'll be discussing about the impact of virtual reality simulator-based training in reducing complications in cataract. So, manual small incision cataract surgery is widely used in developing countries as it is also cost-effective as compared to phacoemulsification. But the main challenge will be training. So, the traditional training relies on direct patient surgery, increasing the risks, high complication rates amongst the novice surgeons, and limited access to experienced trainers in many regions. So there have been alternative training models like the animal or cadaverized inanimate objects and virtual reality simulator. So what is VRS and why VRS? So the VRS was initially used for aviation and now it is used in ophthalmology. It offers M6 training, phacoemulsification, suturing, and complication management. It enhances the skill acquisition in a risk-free environment by providing repeated practice, realistic tactile feedback, and motion physics. So the objective of the study was to assess the impact of VRS training on M6 surgical outcomes, evaluate the reduction in complication rates, and analyze the decrease in resurgeries post-training. So the study design, it was a retrospective cohort study in which the residents underwent a week-long simulation-based training with theoretical sessions. The outcomes were compared before and after the training, focusing on complication and resurgery rates. We had 8 residents with complication rates more than 2% who were selected for the training. So the retraining program, it included 7-day intensive VRS-based training. We had lectures, video discussions, wet lab sessions, and the training was conducted under experienced senior surgeons. So the residents could practice the key M6 techniques and the steps, following which the residents performed independent cataract surgeries. So this is how the simulator room looks like. You can train more than one trainee at a time. And this is the dashboard in which you can select the particular step that you want to practice. So we'll see some examples. This is the tunnel, side port, keratometry, capsulorhexis, the cortex wash, IOL placement, and restoration of the anterior chamber. So the data was collected, intraoperative complications were recorded, resurgeries occurring within 60 days were documented in the cataract surgery database from the EMR system. So in the results, we could see that post and pre-VRS training, the number of surgeries done were almost comparable. The intraoperative complications reduced from 3.6% to 1.2%, which was statistically significant. Some of the intraoperative complications were PC rent with DMD, zonular dialysis, or PC rent with or without vitreous disturbance, dislocation of the nucleus or cortex into the vitreous, and all of them reduced after the simulator training. Coming to the resurgeries, that also reduced from 0.8% to 0.13%, which was also statistically significant. Some of the resurgeries were resuturing or AC deformation, redialing of IOL, removal of the nucleus or cortex from the vitreous, and secondary IOL. The resurgeries also reduced post the VRS training. So basically the training includes a step-by-step surgical tracking for real-time feedback. You can also have a snapshot marking of the errors. That is, you can take a screenshot of your errors and you can discuss it later. There is a performance scoring system according to which you get either satisfied or unsatisfied result, and repeatability. We'll see some examples. So in the first image, we can see that the tunnel color is green. The result is satisfactory. The below image, we can see there is a reddish color which indicates a premature entry, and the result is unsatisfactory. Similarly, in capsulorhexis also, in the above image, we can see it is complete. The parameters are matched and you have a satisfactory result. In the below image, there is a zonular dialysis and hence there is unsatisfactory result. So repeatability. What is the main thing actually with the residents? Some of the residents will be having difficulty in particular step and they can select those steps and they can repeat it n number of times. Again, you can take a screenshot, you can discuss it later with your trainer, and you can judge yourself, and even the trainers can judge according to the performance scoring system. There have also been evidence from other studies which say that there is improved efficiency in performing the steps of the SICS, also enhanced confidence and reduced complication rates after VRS, and it is also more effective than animal models. One of the study also says that you can reduce the OR cost and you can have long-term savings because it reduces the complications, reduces the resurgeries, and you have better resource utilization. So to summarize the key study findings, significant reduction in intraoperative complications, improved IOL placement proficiency, drastic drop in the resurgeries post the VRS training. So to conclude, the training reduces surgical errors, resurgeries, enhances the skill acquisition, reduces financial burden on hospitals, and it supports the novice surgeons in mastering intraoperative decision making. The limitation of the study was the sample size was small. We need larger studies. No direct cost effectiveness was analyzed, and need for multicentric trials to reconfirm the findings. These are my references. Thank you.
Thank you so much. Definitely, simulator-based training is the need of the hour, and it's so helpful for the patients for a safe surgery. Thank you so much.
Thank you so much.